thinking. So there's person-centered planning. So there's a plan that we make. There's person-centered thinking of how we think about people, how we think about ourselves, how we interpret the world around us, right? And then there's a discovery process. There was a training recently that the Regional Center did on self-discovery. And although I've done these trainings many, many times, one of the things that I always like to be reminded of is the listening skill, right? Is listening to the subtleties, especially when the people that I work with age as they get older, right? Their priorities are different. What a good day looks like is different. These are questions that we do add to our ISPs.
Okay.
So if I could have any staff member I wanted work with me, what would that person look like? Would they be my age? Would they also have a disability? Would they have my disability? Would they be the same gender as me, right? And not to say that now you have to go find a staff member that meets this criteria, but these are things to keep in mind, you know, and it also is showing that we're going above what it is that we are required to provide as a service provider. And we're saying, okay, like, these are the wants and the needs of the people we're supporting. And maybe in my employment, you know, hiring practices, I'm going to start looking for people that maybe are a part of the disability community, or that maybe do fit some of those profile and characteristics, you know, especially if they start the DSP University program, which is going to attract a lot of young people to want to be in this type of work. You know, those are places that you can go to.
There's a DSP University?
They, so it's been put on hold, but the curriculum's already being developed. And once we get all of our money stuff situated as a state, hopefully that will bounce back. But the basic concept is the same. Like, one of the things that you could try to do is get interns that are doing social work at a college level. You could try to get people that are already within the system that are regional center clients that want to work. That's a lot of.
Where do you find also too regional center clients that want to work? Like, I'm sorry, like I know there's not a repository, a big list of people everywhere, but she's got to know folks, I'm guessing.
Well, yeah, like when Chris comes to do your HCBS stuff, you know, if you had a wish list for her, and you could say, look, these are the things that I would really like support with to be successful in my program.
Okay.
You know, and then find out like what current resources do they have. You know, like one of the things that we came across was roommates, right? Is people want to live with other people, but some people want to live with people that have the same disability that they do because they feel like it'd be more manageable, you know. So we went to regional center and they said, well, we don't really have an official list, but that's a really good idea. And then they start talking, right? So we're planting seeds of support. And you never know.
Right.
Like, you never know who knows who. So this is the self-determination program. So this is the piece that we haven't really talked about, but these are the elements of what self-determination is. Essentially, it's where the person, the client of the regional center, and their support team take over distributing what money goes to where. So it also, though, allows them to use services that are not necessarily vendored through the regional center. So instead of the service coordinator coordinating those services, the person does.
Okay. I was gonna say I looked at this, the ChatGPT wise a year or so ago, but yeah, that's the main difference. Yeah,
So we included some orientation slides, but if you go to the Alta California Regional Center Learning Platform, they have this training for free. If you go to the DDS website, you can do an orientation that's approved by DDS, and that orientation is, I think it's actually the same one that the clients themselves have to do. So I encourage people to do that one because then you can really see from an outsider's perspective how much work this
Yeah.
actually entails, because it's a
Yeah.
lot of work.
Yeah.
But for people,
Because we have a client in here that, that can, that in advocating for themselves, right? They push on certain things, and like I've always said, like it's not about yes or no or people not wanting to, like, you have your choice. Like we're here to provide you however we can help, but like when there's things that may involve safety or health, like we have obligations to your health and safety. Like if you want to make decisions outside of that, you have the full right to, but you have to gain access to the ability to do that without help. Like basically, if you want X, Y, Z, like you've got to show, you've either got to find a way to get it on your own outside of Alta, but if you're doing it through Alta, you've got to do it the ways that they want for them to pay for the services.
But that's even at a program level too, right?
Right.
So we've done outings where people have gone to Reno, gone gambling, stay a few nights in Vegas or whatever.
Okay.
We have people that go to the movies. Well, the movie sells beer now.
Yeah.
We got people that want to go to baseball games, sell alcohol there too.
Yeah.
They have the cannabis set up over at the state fair now, right? So we implemented policies into our handbook that covers drugs and alcohol and all those things, just like we always have, but with the caveat of, if there's something that's going to affect your health and safety, that's where we have to add additional support.
Right.
So if you go on an outing and you overdo it in alcohol and something happens, probably not going to let you go on an outing like that again.
Right.
Just so you know.
Right.
And everybody, we train on what consequences are, and if you have medication, you may want to consider, like, if that's going to interact or something like that. But we're not going to tell people no.
Right.
You can't do something that's totally legal.
Right.
And you're of age and you can make decisions.
Right.
That's why we have that policy of reasonable risk.
Yeah.
That's the health and safety piece.
Got it.
So I'm kind of in the middle of that myself right now, because myself and another person, I got us, they're called little nitro gummy bears, and they're supposedly the hottest gummy bear on the planet.
Oh, wow.
And we tried another really super hot one before. It was called the Devil's Toenail. And I mean, it was hot, but we didn't like fall out from it or anything. Well, on the box of this one, it says if you have heart conditions or anything like that, you probably shouldn't put this in your mouth. Well, neither one of us do, so we're like, oh yeah, we're gonna try it. But I got an extra box, and so I said, okay, I want to try to find somebody that wants to do it. And one of the participants was like, yeah, I want to try it. And I said, okay, well, does he understand? Like, this is really gonna hurt you. Like, it stays in your system for over an hour. If sometime you're gonna have to poop, it might hurt.
Yeah.
And he says, I want to do it. But are we comfortable with taking that? Is that a reasonable risk for us to do? Is to say, okay, we told you.
Yeah, I can see that being a
So there is that capacity of understanding.
I'm like, did he take it?
Do you know the gravity of it? I put them aside for now because I haven't come to a decision, because I'm still mulling it over myself. And I'm trying to think from like all the different perspectives. Like, okay,
that's because that sounds like it's like right on the line with it. Like,
if I was him and I really wanted to do it, but I didn't totally understand, but I feel like I was missing out on something. As a staff person, if I don't feel confident that that person fully understands the decision that they're about to make, do I have a responsibility? And where does all that fall into a simple thing as a really hot gummy bear?
Right.
And we should all, as DSPs, be thinking like that all the time.
Yes.
All the time we should be.
Right.
Because it's easier to not even bring it up, and to not even, like, just don't bring something like that to work, and nothing like that will ever happen.
Right, exactly. No,
but
you want them to have choices and have these.
We're in the real world.
Yes.
You know what I mean? We all have experiences and things, and
that's part of being an adult, is to have the right to mess your life. Like I was telling you, like one of the, if somebody took your freedom to be able to mess up your own life, it's one of the worst things they could do to you, right? That's what kids are all looking forward to, right? Like, everybody, like, nobody gets out of here alive, but I reminded my staff of that a lot. With safety, it's like you got to balance. It's being caged. Your sovereignty being caged is also a threat to your safety in terms of self-being. And there's a video training that I did about a year or so ago on just the meaning of self-determination. And what does that mean?
Yeah.
What does, and understanding that from client perspective, from how, just the world in general, what does that mean? But yeah, like being able to determine your future is a big part of just mental health, of just being able to, mental and emotional health. So.
Yeah. So the last part of this section are some sample interview questions.
Okay.
So.
Are these outdated?
Huh?
Are these outdated? I gotta ask.
Actually, no, these are the ones that we came up with that are the most common ones that are asked by the regional center.
Oh, I'm thinking job interview questions. Sorry. Okay, no, you're talking about like the questions. Yeah, gotcha.
Job interview questions from someone who just talked about how filing is paper documents is not a thing, right? So these are questions that you can ask your participants now. You can ask them and find out their information, and then take that. And when you're having your conversation with the regional center, when they come, you can say, like, this is the feedback that I've gotten, and these are the adjustments that I'm going to try to make. But if you have somebody that says, is it your choice to be at this program, and they say no, okay, then we need to help you. We need to support you,
right? Exactly.
In having a meeting or having a conversation or talking to your service coordinator or whoever you feel comfortable with. Because we don't want people here that don't want to be here.
Right. Real talk.
I mean, just. That's not, in the end, it's gonna work very badly for you.
Exactly.
Especially as a business owner, it's gonna come out very bad for you.
Right. The last thing we doing is lassoing somebody up and forcing them to
because it's your staff that's gonna feel the brunt of it too.
Yeah.
Because what happens when we do stuff we don't want to do?
Somebody's gonna act out at some point anyway.
Well, we're gonna have behaviors. Yeah. Right. Exactly. Catch me in the morning when I haven't had coffee. You're gonna see some behaviors. You're gonna see some, and it's just my nature and how my routine is. I'm a very routine-oriented person. If my routine is thrown off, my morning's thrown off, and it takes me like half a day to bounce back. I know that about myself, but it's hard for me to communicate that.
Yeah, I see that.
And depends on the person too.
Right,
like if it's my boss and she's like, well, why are you looking at me like that? Right? Because then I'm like, okay, I can't say anything smart. She's my boss. Right? So, but if it's my wife, she's like, why are you looking at me like that? Why are you looking at me like that? You know what I mean? So, so it's just, there's things, right? We all have our things. But this is material for you to not even like read every single thing, but to pick through, take flags and stuff that like you're like, okay, this I can use for this I can use for that, and put the rest on the back burner. And then as time goes on, all of the materials, so like this is a bigger version of like, I like this one. This is my favorite. Things I really don't like. Because it's easy to say, well, I don't like this or I don't like that. But something I really don't like, I really don't like when people complain and they don't provide any solutions. That I really don't like,
No, I love the idea of having our staff